Hi, my name is Abby and I'm a PNW nursing student, and today I'm going to be talking through how to do a bed bath. So first you want to review the patient's record to see if they have any medical limitations and whether you need a second person to assist you with the bed bath. You want to perform hand hygiene, put on any gloves or PPE that you might need if it's indicated. And then you want to ID the patient, discuss that they're going to be getting a bath today, and assist them with their bathing process, and ask them kind of what their personal hygiene preferences are. And then you want to get all your equipment assembled on your over bed table. You want to close the curtain to provide privacy, adjust the room temperature if needed. You want the bed to be at elbow height when you're standing up. That way it's comfortable. You want to remove any compression devices on their legs, like TED hose or anything like that, before you begin. You want to put on gloves, offer the patient to use the restroom if they need to, or bedpan or urinal. You want to, after providing that kind of care, you want to remove your gloves, perform hand hygiene, and then put on another clean pair of gloves. You want to lower the side rail nearest to you, and then you want to assist the patient to the side of the bed where you will work. And you want the patient to lie on their back if possible. You want to loosen the top covers and remove everything except for the top sheet, and then place the bathing blanket over the patient. And then you can fold any linens that are still clean over a chair, and then place soiled linens in the laundry bag. And try not to come in contact with the soiled linens on your clothing. Like, don't try to not let it touch you. Then this is where you're going to remove the patient's gown, and you're going to do it underneath the bath blanket in order to provide privacy for the patient. You want to remove, if the patient is wearing or has an IV line and is not wearing a gown with snap sleeves, remove the gown from the other arm that doesn't have the IV in it first, and then lower the IV container and pass it through the bag, the IV bag, through the arm of the gown. And then rehang the container and check the drip rate. So then you want to raise the side rail after you've removed the patient's clothing underneath the bath blanket. You want to raise the bed side rail, and this is where you're going to fill the basin with water. It should be 100 degrees Fahrenheit and less than 120. Add skin cleanser if it's appropriate. Lower the side rail nearest to you when you return to the bed, and this is where you're going to begin the bath. You're going to put on gloves, lay a towel across the patient's chest that's on top of the bathing blanket. You want to have a washcloth that has no cleanser on it, and you want to just dampen it in the bath basin and wipe from the inner corner of the eye out on both sides, and you want to use a different piece of the washcloth each time you wipe. Then you're going to bathe the patient's face, neck, and ears. Then you're going to expose the patient's far arm from you. So you want the farthest one on the farthest side from you. And then place a towel underneath of the arm to prevent the bed from getting wet. Use firm strokes. Wash the hand, arm, and axilla. Lifting the arm is necessary to get to the axillary region, which is the armpit. And then rinse it and dry it, and then cover the area with the bathing blanket, and then move on to the other arm, repeating the same steps we just discussed. Then you want to spread a towel across the patient's chest, lower the bathing blanket to the patient's umbilical area, wash and rinse the area, and try to keep the chest covered, so wash underneath the towel. And make sure you pay close attention to the folds of skin and underneath the breast. They can get kind of yeasty, and they need to be cleaned as well. Then you want to lower the bath blanket to the peritoneal area and place a towel over the patient's chest. Wash and rinse and dry the abdomen like we just said. Return the bathing blanket to the original position and expose the far leg like we did with the arm. You're going to follow the same steps. You want to start from the ankle to the knee and then to the groin. And then you want to wash and rinse that area and dry the foot. Then you want to do it the same steps that we just discussed for the other leg. Make sure the patient is covered with the bath blanket and change the water and washcloth as much as necessary. Like, you don't want to be using dirty water on the patient. That's disgusting. Next, you want to assist the patient to a prone or side-laying position to wash their back. You can put on gloves, like new ones, if you want. Position the bath blanket and towel to expose only the back and buttocks area. That way their chest is still covered when they're in side-laying position. You want to wash and rinse the back. Pay particular attention to cleaning between the gluteal folds and observe for any redness or skin breakdown in the sacral area, because that's a common place for skin breakdown to occur. If it's not contraindicated, you can give the patient a back rub at this time. Then after you're finished washing, drying, and giving a back rub, if it's indicated, you need to raise the side rail, refill the basin with clean water, discard your washcloth and your towel, remove your gloves, and put on clean gloves, because now you're going to clean the peritoneal area. So you want the patient to be as involved in their bed bath as much as possible. So if the patient is able to do certain aspects of this bed bath, you need to allow them to. That way it increases their independence and also allows them to be involved in their care as well. So back to cleaning the peritoneal area. If they're able to clean this area, you can go ahead and let them. You want to wash from front to back and cleanest, or dirtiest to cleanest, sorry. And then you're going to raise the side rail again, remove gloves, perform hand hygiene, help the patient into a clean gown, assist them if they want to brush their teeth, put on makeup or deodorant, do their hair. You want to protect the pillow with a towel, so like place a towel over the pillow and then brush the patient's hair, and then you can roll the towel up after you're finished brushing it and discard it into the dirty laundry. When you're finished with all of your care, you want to make sure that the patient is in a comfortable position, that the side rails are up and the bed's in the lowest position. You want to make sure that the patient has their call lights. You want to change the bed linens and dispose of the soiled linens according to facility policy. And then just clean up all your equipment, take off your PPE, and perform hand hygiene. And that is how you do a bed bath.